Today, I want to welcome back Lenora Edwards. She is a returning guest, only the second one ever. And Lenora is just a delightful, delightful person, as you will see soon here. But what we're going to talk about today is she has a business called Better Speech, and she provides online speech therapy. It's particularly interesting to me because I dealt with speech therapists when I was in the rehab hospital. And there's a lot of confusion about what they do. So we're going to start off, we're going to talk about that, but let me tell you where we're going. If you have a business, this is something you want to listen to. If you're in business at all, or let me broaden it out. If you have a need to communicate with anyone, you want to tune in because you're going to walk away with some practical applications and some new insights. And so, Lenora, welcome.
Thank you so much for having me again, Craig. I so appreciate it. And I love spending time with you. So this is great.
You know, we ran into the same problem we did last time was we basically have already done a complete episode just in the green room chatting back and forth.
We
And
are quite chatty, you and I.
we are. And it's fascinating. One of the things that was really confusing to me, and I had to see it kind of played out when I was in rehab. And so, for those that don't know my story, I was in a coma for 6 weeks, in the hospital for a total of 3 months, and basically had to rebuild everything, including eating, which speech therapists are responsible for, including thinking. I've had to reconnect some memories, and turns out speech therapists do that too. And so it's a really deceptive term. What is a speech therapist?
You are correct. It is a little bit of a deceptive term. So, oftentimes, yes, we do call ourselves speech therapists, and we are also known as speech language pathologists. And what we help people do, especially at Better Speech, of which I just want to share that I do not own the company. I am the chief knowledge officer with the company. We do provide online speech therapy services. And what that looks like is FaceTiming and Zooming. So, really, we use the Zoom platform and we have the ability to help people all over the world because we provide high quality speech therapy services that are affordable and convenient. So, when it comes to speech therapy, we work from the neck and up. So, yes, a lot of the time people will hear, "Oh, you're a speech therapist. How clear is my speech?" And while I do listen for the clarity of somebody's speech, we really do so much more. And this is why I say from the neck and up, because we do help people improve their swallowing. We help people with their voice. So sometimes we work with individuals who might be experiencing a voice difficulty, a voice challenge, throat cancer. We also work with individuals who have what we call oral motor weakness. So it might be weakness of the lips or the cheeks or the tongue or the mouth, and will help them build their skills, their oral motor strength back up. We also work on their intelligibility, so their clarity of speech, but also language, as in how well they understand something and how clearly they can express themselves. And then we also work on cognitive skills, so things like memory, reasoning, sequencing, conversation. So, really, the neck and up.
Yeah. Yeah, I think the first exercises, well, the first thing that I learned about speech therapists was they were my pathway to getting back to eating solid food.
Mhm.
I went from all of my meals came through a tube in my stomach, to they started letting me eat crushed ice, to I could have broth. And I remember one day they were doing x-rays and they gave me like pudding or something. And it was the first thing I'd had with flavor. And I was like, let me finish that. And they're like, well, it's loaded with barium. We probably shouldn't.
So, absolutely. So, for individuals who don't know, people can have difficulty swallowing, and swallowing is a reflex. So, as a clinician, I've worked in the neonatal intensive care unit, I worked in the pediatric intensive care unit, and where you work, dear Craig, in the adult intensive care unit. And there's such a thing as difficulty being able to swallow your own saliva or difficulty swallowing nutrition safely. So, oftentimes for babies, we'll work on suckling, we'll work on their suck, swallow, breathe pattern. And it's really important because when we're swallowing, the food and all your muscles coordinate very effectively to close off your airway and to transfer the food into your esophagus, which then goes down to your stomach. If there is weakness in your throat area, what can ultimately happen is food or liquid can go into your lungs. And that's exactly why they were very careful with what they gave you, because you might not have had the cognitive ability to safely consume nutrition. And you might not have had the literal physical ability to safely consume nutrition. So when they gave you barium, they also did an X-ray and they were able to see if it was going into your lungs or if it was going down toward the esophagus the way that we all want.
When, I still have a problem where I'll wake up in the middle of the night choking.
Mhm.
Something went down the wrong way.
Mhm. And
Yeah.
sometimes, yeah, people will say, "Oh, I have phlegm in my throat." And it can be sometimes it can be what we call pooling. And it might just be your saliva or mucus just hanging out in the back of your throat. And your muscles aren't transferring it down into your esophagus where it needs to go. And it might just kind of be sticky and hanging out there. Sometimes when you swallow, it'll eventually clear it. Or other times you might hear people throat clear or cough really hard to get that up and out of the way.
So the at the rehab hospital, at that point, I think when I went in, I think I was on broth and then quickly went to anything I ate passed through the blender first.
Mhm.
But I met this speech therapist named Trang. She was there for a week and she was working on the cognitive skills that you were talking about. But she also had me do this exercise. And I don't know what was going on, but I couldn't complete it because I would just start busting out laughing. And my wife liked it because it was the first time she had seen me laugh in 3 months.
Mm.
But I had to do this thing where I would go, "Yee," something like that. And
Mhm.
all I could picture was Alpha Alpha from the Little Rascals doing his little voice exercises. And I could never finish it. And I knew it had to be important because, there
Yeah,
was
making you do.
trying to get my speech back. And
Mhm.
so what was that? What was the point of that exercise? What was she working on?
So sometimes in this case, especially for individuals who had a trach. So for those who aren't quite sure what a trach is, the doctors will create an opening at the base of your throat and they will put an apparatus or a trach in there to help you breathe because you might not be able to successfully breathe through your mouth or your nose. So this device will help you breathe more easily. And sometimes you might be to a machine. That machine might be helping you breathe more effectively. Now, when there is a trach involved, ultimately there is an interruption in the airflow that was there. So now we have to build that skill. We have to build those muscles, especially because of all the weakness that you experienced and that you had as a result of staying in bed for so long, of not being able to do certain things for yourself. That also being said, just like your legs get weak, your throat muscles get weak, your swallowing muscles get weak, your vocal cords get weak. And we want to build that back up. So even in such an exercise as you're really working to shift your voice, but at the same time, your muscles are squeezing together and your vocal cords are coming back together as we're talking. So everything that I'm doing right now is considered the expressive part of language. So I'm talking, but also my vocal cords are going back and forth, back and forth, back and forth, opening and closing, letting my voice travel the way that it needs to. When I'm breathing or when I'm just listening, so when I'm not talking, my vocal cords are open. Our vocal cords have to come back and forth, and that's how we also then get sound. So she might have been working toward building the strength up back in your voice, as well as the volume, as well as the pitch, and building that intensity. So there are a lot of things going on in such a fun little exercise of yee.
Yeah. So, yeah, and that makes sense. And what we were saying about the atrophy was so bad it even impacted my vision. My eye muscles, hadn't had to focus for a while, and for it was close to a month after I woke up, everything was blurry. And she actually got upset. I kept saying her name wrong, and she's like, "Look, my name is Trang. I wrote it on the board." And I was like, "Trang, everything's blurry. I can't see." And she quickly turned, she's like, "Oh, I'm sorry." And 'cause she got really irritated by that. But yeah, that's how bad it is. But most people that are listening haven't been in a coma, haven't had to trach, haven't had to do this. And but you help people who haven't had that trauma. You help people that might have otherwise normal lives.
Very much
And
so.
and what sort of help do they need? What's going on? Why did people call you?
People call us for lots of different reasons. And in your case, especially with, well, some people, I just want to make a note, some people might think, oh, 6 weeks in bed sounds like a great idea. Not so much. A lot of atrophy does occur, a lot of physical weakness. So taking yourself to the bathroom, even standing up on your own, is exhausting if you've been in bed for a very long period of time. And the reason that people reach out to us, some people are not experienced, as in they didn't go through a coma. They didn't have the very, very long process of rehab that you had. Some people reach out to us, for example, one of my clients, the client is in their 70s. Their loved one that I also see on the camera is in their 50s. And the reason that they reached out to us is because the older individual, the parent, is experiencing signs of dementia. So they're
Hmm.
having memory loss. They're putting their milk in their cabinet and they're putting their cereal in the refrigerator. Their keys are not going in the proper place. They're missing bills. So things like that to help people really keep their organization, but also to help keep their independence. We work to make things more structured, more organized for them so that there is routine. And that's very important because we have neurological diseases, which are very unfortunate. And there is a progressive decline, which is very unfortunate. That being said, we can still build in new processes and we can help individuals maintain their current skills. And a lot of the time people will think like, oh, I have Alzheimer's or oh, I have Parkinson's and oh, I go right into a nursing home. No, no, no. You do not you do not have to, you know, do not pass go and collect 200 and don't collect $200 and go straight to there. You can find ways to keep your independence and to stay at home. Having online speech therapy services is one of them. There's also online physical therapy services. And the great thing is that when you have telehealth, which we are, when we have telehealth practices, we get to be in the place where that individual is the most comfortable. Quite literally, we are in their home with them. We are a part of their daily routine. So rather than having somebody come out to the clinic, where especially if you're 45 minutes away, that's a long drive. And now you're wondering, how am I going to implement this at home? When you have online therapy, especially with better speech, we Zoom with you. You join our meeting, and we have a designated time of when we meet on your schedule at times that are convenient for you. And then we can also hit the record button. So that way, after therapy, if you're going, wow, that was a good therapy session. What did they say though? What was that part? I totally don't remember. You have the ability to go back to that recording and repeat the information, learn the information, integrate the information. And that's a beautiful thing of the many wonderful things that technology does provide us.
You mentioned the Alzheimer's patient, and myself, and I would imagine most people grew up being told that saturated fats are bad.
Mhm.
And at one point in my journey, they said, "Hey, Craig, you should eat butter." And
Mhm.
I was like, "Why?" "It helps your myelin sheath." I'm like, "What's that?" They're like, "Doesn't matter. It's important." And so I was also trying to gain weight at the time. So I mean, I put butter on everything.
Mhm.
But apparently, I mean, if I've been able to connect the dots correctly, butter, which is a saturated fat, actually helps. The myelin sheath is something what wrapped around our nerves, and it actually helps in things like Alzheimer's or just your general neurological health.
Mhm. Yeah, absolutely. There's a lot of things, especially when it goes to nutrition. There's so many conflicting pieces of information. And when it comes to nutrition and how to have brain health, I am a big supporter of do the research. But by research, I don't mean just watch a 20-minute episode of one piece on the news. Do your research, get a book, go on YouTube, find other people, study the information. When it comes to nutrition, it's not something that we should be solving in 20 minutes and then there we go, then we have it. Allow it to be a part of your life because what you needed at 20 years of age, what you needed at 30 years of age is not the same nutrition that you need at 50 years of age. That being said, a lot of the food that we are having on our grocery store shelves might be processed food in such a way that it's not necessarily the most nutritious. Our culture is very big into low calorie, low fat, and replacing all of these things with other pieces of ingredients that might not serve our most optimal health. So, really knowing what your blood work looks like, knowing how your body's operating, knowing what you need to sustain yourself, to enjoy your life on your terms is the most important. So allow yourself to really explore what that looks like. And if having more butter is something that is, hey, you know what, this is good for brain health and this helps me, da, 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 da. Okay, great. I wouldn't necessarily sit there with a whole stick of butter in one day. That might not be the most nutritious, but integrating certain things into your nutrition plan is absolutely vitally important.
Well, one of the problems that we have, and I think this is one of the challenges with the research, the origins of the whole thing about saturated fats being bad goes back to Harvard from the 1960s. Bunch of Harvard researchers published research saying butter's bad or saturated fats are bad. Turns out the people that funded that study was the sugar industry.
Mhm.
And they were trying to take the pressure off of sugar, and they just fudged the results. And it shaped decades of medical guidance. And it was just crap. They bought them off. They bribed them.
There's a lot of very interesting things when you really start to dig down. One of the fantastic book that I have used as a great resource is Death of the American Food Pyramid.
Mm,
And it goes into the history of how the food pyramid was initially created. And that's why I really encourage people, what my parents learned in the 70s and the 80s, what I learned from my parents and then grew up with in the 90s and in the early 2000s is not the same information and it's not the same food products that are on the shelf. It is something to really consider looking at and exploring and really being the detective of what your body needs.
yeah. So let's go back to the speech part of speech therapy.
Mhm. Mhm.
And what and let's put this in the context of like the business settings, because that's a lot of our audience here.
Mhm.
From the outside perspective, when you're looking into the business settings, what type of problems are you seeing in terms of communications and speech?
When it comes to, so one of the things that we do at Better Speech is we provide communication coaching, and that is different than accent modification coaching. When we're talking about communication, how are people interacting on the team? What does active listening really look like? And are people able to really effectively express their thoughts, express what their ideas are? And there is a difference between talking and expressing and responding to what somebody else said. When we're working to respond, we're more on the defense versus let me really make sure that I understood what you said. And one of the biggest takeaways and one of the biggest keys that I could ever share is when you're communicating, yes, language is important. The words that you choose, definitely important. But what's more important is the tone at which you share. There's a different way to say, "Hi, how are you?" versus, "Hi, how are you?" There's a different way that says, "What are your thoughts on this? What are your thoughts on this?" It really comes down to tone. So if your biggest takeaway should be, let me if I don't have time to have a communication coach and to really build these skills, let me do my best to notice my tone. We want to be present when we're with people. We don't want to be looking at our watch and getting distracted by another pop-up alert. And even on Zoom, a huge thing I'm noticing on Zoom is we can be having a conversation and somebody's eyes keep slightly darting. They keep slightly darting. They might be sending an email, they might be getting an alert, of which, yes, that's important. At the same time, you have a human in front of you. Let's be respectful to other people. and really engage with them and be present in the conversation. So that way you can then consider yourself an active listener, but also somebody who's really working to solve the problem or to participate in the thought, to participate in the task. You're with other people. Allow yourself to be with other people.
And I looking at myself, I've slipped into some bad habits that I'm trying to get out of. That when I'm on
We
Zoom,
all do.
yeah,
Yeah.
when I'm
We're
on
human.
Zoom, I I've started minimizing the windows,
Mhm.
and because it's easy, I don't perceive that my eyes are darting around. Now, fortunately, I produce a podcast, and when I see myself and moving keeping my head steady and moving my eyes, and it actually looks a little bit freaky. Uh, it looks almost like Marty Feldman, going around. But I think, well, they're not noticing, and it's um, I think I just think broadly we've become a less considerate people. And I blame, I spent 15 years in the mobile phone industry. And unfortunately, my work fueled a lot of that. Some of the worst habit, I was at Starbucks the other day, and this lady comes in with her phone on speakerphone. She's there with her husband and kids. She's ignoring them. She's holding this conversation, and everybody in Starbucks is hearing this conversation. And she's present with nobody that's there.
Mhm. Yeah.
And that's a little bit of an extreme example, but just, checking text messages and what have you when you're talking with somebody, it's, what I found, I don't know if I've ever gotten a text message. Maybe. I don't know if I've ever gotten a text message that couldn't have waited 30 minutes or an hour to respond to.
Yeah. That's a very good point. And it's unfortunate because ours, as helpful as our devices are, they're also in training us that something else is more important than the person in front of us. They
Yeah.
train us to look for alerts. They want you on the platform. And there's so many fantastic things out there. And, especially being a part of this culture, always understanding that there are two sides to everything. There is a wonderful side to technology, and there's also a not so wonderful side to technology. There's a wonderful side to doing certain things, and then there's also another side to it. You cannot find anything on this planet that you can only discuss one way. Everything has two sides completely.
Yeah.
So really it's something to be aware of, and what is important to us about communicating. Is it important that I send this email? Or is it more important that I give this person the time? Now, that being said, if I need to urgently send something, excuse me, I apologize. I need to pause for a minute. Let me do this so that I can then give you my undivided attention.
Yeah. Now, when you were talking about ways of speaking, the other thing that was resonating with me there is I grew up in the Northeast, but except for when I've lived overseas, I've spent the majority of my adult life in the South.
Mm.
And it's impacted how I communicate because, in the Northeast, you just kind of you say what you have to say and you get it out there, and you just kind of take it at face value. There's no malice. You communicate that way in the South, and you're ready to start another war.
Hmm. Very true, especially where our culture is. And there are different parts of the world and different parts of the US where it's appropriate to say one thing and it's not so appropriate to say another thing. And that I think is raising your awareness of how other people communicate. You can go to eye contact. Some people we and in the US we engage in eye contact. You go into other countries, they don't engage in eye contact and it's a form of disrespect. So it's really something to be courteous of. How does this person best communicate? How do they like to communicate? That being said, how do I like other people to communicate with me? If you go to somebody and you have a specific tone, they might not do anything with you because of how you approach them. When you approach somebody as, oh, you're a person, let me show you kindness and respect, and then we'll talk. That is much, much more engaging than going up to somebody abruptly going, what were you thinking?
Yeah. Yeah.
Huge difference.
The other thing I noticed, and it was really bad when I first moved to Texas. I moved here from North Carolina, and it's funny, all the Texans thought I had a North Carolina accent. I'm like, I
Mhm.
promise I don't. Nobody in North Carolina claims me. And but I would, I went back, I think, there was a period of time I'd spend 1 week in Maryland over Christmas and 1 week in North Carolina. And I come back to Texas, and the thing I noticed was for the first 2 or 3 weeks, I had to say everything twice. I'd say something, and nobody understood what I said.
Mhm.
And I'd slow it down and repeat it again. And they're like, oh, okay. And I'll give you an example. So the name of my business is, I'm going to say it the way I say it in Texas, and then I'll say it
Mhm.
the way I say it with my home accent. Name of my business is Allies for Me. Now, as a speech therapist, you probably heard me deliberately drag that E, kind of like I'm dragging a chain across the road, because the way I naturally say is Allies for Me. And nobody understands me. They're like,
Mhm.
Allies for May? I was like, no, me. They were like, May? I'm like, no. And and I think this is a challenge. And it's, again, we've moved out of the clinical. This has nothing to do with spending 3 months in a coma, or 6 weeks in a coma, 3 months in the hospital, and going through atrophy. This is just the accent that was common where I grew up, but it's creating a barrier
Yeah.
between
That and the
me.
dialect.
Yeah.
Mhm. Yeah.
And so I guess here's a question. Obviously, communication is important. At the same time, nobody wants to totally surrender their own identity, their own heritage. And so, how do we navigate that?
I would say to navigate it in the most kind way, but also in a way that is important to you. So, when we're navigating it, it really depends on where you are in your culture, where you are at work, what are the themes like, and really being able to be observant and take into consideration what I lovingly refer to as the art of communication. We do communicate very differently with our parents versus at work. We communicate very differently with our significant other versus somebody at the checkout. So it really is important to notice how you communicate, but also that you're communicating clearly so that not only can the other individual hear you, but you can also get your wants and your needs and your thoughts expressed clearly to other people.
Yeah. Well, as we wrap up, and we've covered a lot of ground, everybody would agree that clear speech, clear communications is important if you're in business. And it's important for you to be a leader. What would be, let's say, 3, 5 symptoms that people would notice that would tell them that they probably need to give you a call?
3 to 5 symptoms. And in communication coaching, if you find that there's a big breakdown in communication where you work and people don't necessarily come to you, but things always get back to you, there's a reason that people aren't necessarily approaching you. And if there's more than one or two or three people, it might be you. And that's okay. Allowing yourself to recognize that communication is ever evolving and our ability to communicate more effectively with other people can always be built upon. When it comes to other individuals, if they're noticing, maybe I want to improve the way that I speak so that my filler words aren't necessarily there. If you're noticing ums, ahs, and likes occurring more than 10% of the time when you're talking, even if you talk and you record yourself for 2 minutes and you just ramble and see what comes out, notice how many ums and likes there are in those 2 minutes. If there's more than 10, you probably want to speak with somebody and see if you can build those skills up. But that being said, is it important to you? If it's not important to you, then that's not necessarily worth your time and your investment. Another one would be if you're noticing, man, I am just not as clear as I used to be. I am not on the ball. Something's wrong. Reach out, talk to somebody, reach out to professionals. Professionals are different than friends. professionals will give you their ethical, moral opinion of where you are at that point in time, what your goals are, and if they can provide you information and if they can provide you support.
That's great. And how would people reach you?
Best way to reach us is to visit our website at betterspeech.com.
Well, Lenora, this has been a delight yet again. Thank you for coming on Leaders and Legacies.
Thank you for having me again, Craig. It was so wonderful spending time with you again.